Abisiafo, yɛfrɛ me Mrs. Scriptures. Mekamfo Nels Calvin TV ama obi biara. Abisiafo, yehia ne sɛ obefa wo phone. Na wako YouTube, wako TikTok, wako Facebook, any social media handles ni biara. Wofa wo phone na wokɔ a, na wabɔ Nels Calvin TV. Mbamo chow, ebebie, ebia, ye videos ni nyinaa oho. Wohwa na wa subscribe, na wa like, na wa comment, na wa share. Yeda mu nyinaa se.
Hi lovely viewers, welcome back to Nels Calvin TV. On this episode, I want us to talk about some terminologies in mental health nursing that you must know as a nurse. Have you learned about mental health nursing before? Or is this your first time going to learn about mental health nursing? Then I will let you know that this video might be of help to you, for you to get to know some things before you learn about mental health nursing, or also let you get to know how to care for patients who is mentally challenged, how to diagnose them. And subscribe to this channel so that anytime I'll go video on this channel, you'll be the first to watch. So before we get into the video, let's talk about mental health. When we talk of mental health is the state of an individual, which that talks about the patient with emotional, the physical, the psychological, and the social well-being of an individual. Then when we talk of mental illness talk about the disorders that affect the mood, the behavior, and the thinking of an individual. You get me? Then when we talk of the mental health nursing or the psychiatric health nursing, is a branch of nursing that cares and also give treatment to people who are mentally challenged. So guys, let's get into the terms that we are going to talk about today. The first thing that we are going to talk about today is what? Schizophrenia. Schizophrenia simply means a disorganized thinking or delusion or feeling what hallucinated. So the patient thinks about things and feel things which are not real. The patient behaves in a way which are not accepted in the society, or the patient behaves in a way which is different from the reality. Then we have hallucination. When we talk of hallucination is feeling or hearing, or the patient might be maybe seeing things which are different from the reality, or those things are not real and yet real. So what I say. So they will see things, then they will hear things different from the reality, or those things are not real. Or what those things are not real. The patient is hallucinating. Then we have a delusion. So when we talk of the delusion also means that the patient is feeling or having a false feeling. So what I say, or believing in something which is different from the reality, or which is not based on the reality. The patient is believing in something and that thing, and yet based on on the reality. So the patient might be saying, the TV never the people on the TV are rather watching you or hey, those things are not real. So they see things differently. Then also talk about phobia. So when we talk about phobia means irrational. So what I say, irrational fear of a specific something. Irrational fear of specific something, such as the fear of spider. We are the fear of height. Height was so irrational fear of a specific something. So let's also talk about bipolar. So bipolar also talks about the mood. Such as to affect the mood from high to low, which is known as the mania. The mood. Let's also talk about depression. So depression is also another term in mental health nursing, which talk about persistent sadness or loss of interest. So I will make a video about depression, let you know the cause and how to also prevent yourself from getting depressed. Then we have anxiety. So when we talk of anxiety talks about intense fear or worry. Or worry. So you see, say we one now will go through some pains or going through some situations. The patient are like, well, who be, and the patient is terrified. The patient can go into anxiety. Some patient condition can lead the patient into going into anxiety. Then we have apathy. So when we talk of apathy, lack of emotions and interest is also another term in mental health nursing known as apathy. So what I say, known as the lack of interest. So or lack of emotions. Then we have euphoria. So when we talk of euphoria is extreme happiness. Then we have suicidal ideation, suicidal what ideation. So thinking about or planning what of suicide. Then we have insight. When we talk of insight, also talk about awareness of what of the patient's condition or one's what condition. So maybe the patient has insight about his condition. So having what awareness of it. So guys, let's talk about psychosis. Psychosis also means this what connection from the reality. This connection from what the reality. So the patient is what often what involved in what in delusion and what hallucination. So that's known as what psychosis. Psychosis. So thank you guys for watching. Keep on watching the Kevin TV. The next episode is going to be about cannulas. Thank you guys. I love you. Bye.